Hi, I'm Dr. Chris Collar. I'm an online integrative family physician. I'm doing my practice entirely online, and you can find me at drcollar.com. I have been getting so many calls on upper respiratory sinus infections that I thought, you know what, I'm going to do a quick video, hopefully quick, to just give you guys some ideas on how to treat colds, sinus infections, upper respiratory illnesses before we end up having to use antibiotics. Okay, I recently put together a little a cheat sheet that I'll have available on my website as well, and it's also on my Facebook page. But I'm just going to go through this in kind of a brief way to give you guys the tools that you need so that you can get better. You know, these upper respiratory things are miserable, and you know, a lot of times we end up treating them inappropriately with antibiotics much too quickly. So, all right, so what's the first thing we do? The first thing is you start to get that little yucky, icky feeling in the back of your throat, something's not right. The first thing that I do at the first sign of any yuckiness happening is saline. A saline rinse, ideally. So maybe you've heard of a neti pot or a sinus rinse. These are, I have an example here, a little bottle like this. You fill it up with clean water and you put the little salt baking soda packet in there. You shake it up and you put it up to your nose and you squeeze it, and the water goes up through the nasal passages and out the other side, bringing with it the virus, the mucus, the grossness, right? It's a little yucky, but you do that, you blow your nose, you get a bunch of stuff out, then you do it the other way and you get the rest of the stuff out. Do that 2 or 3 times a day, and that will mechanically flush that stuff out and help you feel a little bit better. So I highly recommend using that 2 or 3 times a day at least. So first thing in the morning, and then definitely right before bed, and if you feel that glob of junk back there, do it again, you know, as many times as you want. It's very, very safe. Okay, you definitely need to use warm water, not too hot, not too cold, and also you have to use the little salt baking soda packet, otherwise it's going to sting a little bit. So first thing is saline rinse. If you don't like that very well, then I would recommend as a next best option using a nasal saline spray multiple times throughout the day. Just shoot it up there, and that salt will actually help the mucous membranes. So that's step number 1. Step number 2 is just the basics, taking care of your body. Hydration and diet and rest. Okay, drink as much water as you possibly can. The more water you drink, the thinner the mucus will be, and the more you can get rid of it. I know it's kind of annoying to be blowing your nose constantly, but that's a good sign. You know, the more you get that out, the less likely the mucus is to harbor bacteria. Okay, and that's really what ends up happening. You have mucus stuck in the sinuses or in the lungs for a long period of time, and then the bacteria that exist can start to grow there. So we want to prevent that from happening. Drinking lots and lots of water is going to help that. It's going to thin the mucus out so you can get rid of it. Additionally, you got to eat well. You know, avoid that temptation to just go to the junk foods and the comfort foods. Avoid the refined carbohydrates, the sugars, the gross, you know, or the yummy, but the not good for you foods. And go for the fruits and the vegetables and the soups and the bone broths and those sorts of things that are going to provide your body with the nutrients that it needs to heal, okay? I know for myself, I tend to crave, you know, onions and garlic and peppers, spicy foods even. You know, I bought wasabi peas, you know, like just something to get the mucous membranes moving. And I think that is really helpful. So if you like those sorts of foods, you know, I would use them, because I think that your body does crave those sorts of things. All right, and then sleep. You know, you got to take care of your sleep. Go to bed early. Take some, you know, nighttime cold and sinus medicine, and go to bed early. Take a nap if you can. Get rest so your body can heal. If you keep pushing and pushing and pushing, you know, you got so many things you got to do. Your body's telling you you need to rest, and so you really need to do that. Okay, so that's number 2: hydration, rest, and diet. Number 3, supplements. There's a lot of supplements out there that, you know, I don't know. I love and I hate supplements, you know, because in a sense, biochemically, yes, we have need for certain nutrients, and maybe the demand for certain nutrients does increase depending on our state of health. But do you need to take everything on the shelf? No. You know, or everything in a magazine? No. So don't overdo this part, but I'll tell you the things that I use, okay? First, I use vitamin C. You know, that's an antioxidant. I take maybe between, I don't know, 4,000 and 6,000 milligrams a day. And, you know, that seems to help the immune system a little bit. Number 2 is zinc, okay? Zinc picolinate is what I use, and I use about 50 milligrams per day. That's also got some immune supporting properties. Vitamin D, you know, I live in Michigan, don't get tons of sun, but and a lot of my patients are very low in vitamin D, so during times of illness especially, I will take about 5,000 international units daily of vitamin D3. Some other things that you can try would be colloidal silver. So silver ions have kind of an antiviral, antibacterial property, and you can find this liquid called colloidal silver, which has those ions dissolved into the liquid, and you can use that in a variety of ways. You know, you can take a little, you know, a teaspoon of it, hold it under your tongue for 20 seconds and then swallow it. Some people will gargle it if they've got a sore throat. I've put little bits into my sinus rinse here a few times and then done the rinse. You know, the idea being that if I can target the sinuses with that saline, with that silver, then maybe that'll have an effect. I don't know, 100%. I've definitely had it work in other illnesses, digestive bugs and the like. But anyway, colloidal silver is another option. Then there are other products that seem to help boost natural killer cells, which are some of the immune soldiers in your blood. So if you're interested in the supplement world, you can go to the store link in my website at drcollar.com. It'll take you to a platform called FullScript. In that platform, I've got various categories. One of those is viral illness, and examples of those sorts of supplements are there. If you'd like to, you can, you know, order them and have them shipped to your house through my platform, or you can just use those as an example of what to look for when you go to the store. Okay? All right, number 4. Hands-on techniques. So I recently did a series of videos on my Facebook page when I and my family were dealing with sinus infections, and one of those videos I did describe a number of these hands-on techniques, and I want to hit them quickly with you here. These are things that you can do with your hands to try to mobilize the mucus and reduce the swelling and pressure in your, you know, mucous membranes. The first one is a trigeminal nerve massage technique, and there's a couple spots that you gotta kind of find and rub. The first one is right above your eye. There's a little hole. This is where one of the branches of the ophthalmic division of the trigeminal nerve comes out, okay? And if you find this little notch, you can kind of just use your fingers and gently massage it in a circular pattern for about 20 to 30 seconds, okay? This is stimulating the nerve there. So we're gonna kind of speed this up, but you can, that's the first one right there above the eyes. Then there's another notch down below the nose, or I'm sorry, below the eyes in the cheeks, and you rub that for 20 to 30 seconds. And then finally, actually no, those are the only two. So superior above the eyes, and then inferior below the eyes. This is the maxillary division of the trigeminal nerve. So that's a nerve massage. The next one is a tapping technique where you tap on the frontal sinuses for 20 to 30 seconds. And if you've got a sinus infection in there, then this is going to be kind of painful, but hopefully we're doing this before it's gotten that bad. The next spot is kind of underneath here at level with your nose, going in an upward motion, tapping pretty quickly, 20 to 30 seconds. Again, I'm doing this briefly to kind of speed up our video. And then the third spot is right here at the nasal crease, tapping at that. And this can sometimes, again, stimulate the nerve and the sinuses to release that mucus and get rid of it. That's what you want. There's a sinus effleurage technique that we use in the osteopathic world, which involves kind of moving the lymphatic drainage to the chains on the lateral sides of the neck. So you start in the frontal sinus and you kind of rub like this, and then you move underneath the nose and you kind of do that. And this can kind of feel good too. And then ideally you kind of push it down, so you're pushing the lymphatic drainage and fluid out to the ears and then down to the rest of the body where the where the rest of the chains are. So that is a sinus effleurage. And the final one I saw that people do is a nasal septal stretch. So you kind of grab onto your cheek, you grab onto your nose, and you stretch and hold that cartilage, 20 to 30 seconds as well. Sometimes this will get your nose running, and so keep a box of Kleenex handy, and then you do it the other way. So those are 4 techniques that you can use, again, to just try to get that mucus moving. That's the goal. Okay, 5. This is a big one. The over-the-counter OTC meds. All right, and I'm not going to write all these up there, but you can visit my Facebook page to see kind of the longer lecture on this. But just briefly, I'm going to hit on things. The important things for you to know about over-the-counter medicines. When you go and you see, oh my gosh, there's like 1,000 different brands. What do I pick? The key to unraveling and decoding all of this is knowing the generic names. Okay, I know they're big words with X's and Z's and Y's and all kinds of ridiculous spellings in them, but if you learn like the 15 different medicines that are in these things, then you can start to not double up on things. You can start to understand where are you getting better value, because this one has more acetaminophen than this one does and it's cheaper. Okay, so real quickly, the various categories: pain and fever. Okay, these medicines are going to be your acetaminophen, which is Tylenol, your ibuprofen, which is, you know what, maybe I do need to write this up. I'm going to try to be fast with this. I don't want this taking forever, but these are important. So over-the-counter meds. So pain and fever. This is acetaminophen. And I've got this handout too that you can download, and it does have an abbreviated version of this. Ibuprofen, naproxen, and aspirin. I forgot that one before. So these are all kind of the pain and fever medicines. So you don't need to be doubling up on those things. I mean, we do alternate Tylenol and ibuprofen sometimes with kids, and that's okay. I wouldn't double up on naproxen and ibuprofen, because they just kind of get processed the same way, and that's too much NSAID. So those are going to be the pain and fever reducers in Dayquils and NyQuils and Advil, cold and sinus, and those sorts of things. Then we got the decongestants. These are the medicines that will kind of dry you up. They'll target the mucous membranes that are swollen and boggy and kind of shrink them up a little bit. These ones can also elevate your heart rate and blood pressure, so these are not really recommended for folks who have anxiety and high blood pressure and other things. So also, I forgot to qualify this, but this is for healthy adults, otherwise healthy adults. If you have a variety of illnesses like diabetes, heart disease, and, kidney problems, liver problems, and be careful with what you do here. I mean, you can do the saline rinse and hydration. I mean, you can do everything up to this point, but talk with your doctor about starting these kinds of medicines. I know that there's like Coricidin. It's the heart healthy cold medicine, which is just the same medicine as guaifenesin in your Robitussin and such. So anyway, decongestants. These are your phenylephrins, your pseudoephedrine, which is in Sudafed, which you have to sign for behind the counter. It's not available on the shelves anymore. And then one that I use a lot that I want to comment about is oxymetazoline, which is a nasal spray. My personal approach to handling over-the-counter medicines is that my top priority is getting sleep. So if I can't breathe overnight, then I don't get any rest and I feel worse in the morning. I've got post-nasal drainage, and the next morning is worse than the night before. So I really hit my colds hard before bed. That involves usually doing some sort of a decongestant or a combination medicine like NyQuil. And even a small dose is sometimes enough to help me get some good sleep, okay? So half a cup full, whatever. So I'll usually do a NyQuil swig and a saline rinse, and then I'll use the oxymetazoline nasal spray to really just open it up really good overnight so that I can breathe and sleep. And man, that makes such a huge difference. Now, I've mentioned this before, but these nasal decongestants you do not want to use too frequently. So maximum is twice in a 24-hour period, but I really only limit it to bedtime for myself because you get rebound swelling. So after it wears off, then it's like all full again. And it's maybe even worse than it was before. So and even if I only use it for 2 or 3 nights, I can sometimes get that rebound swelling. So I'm just really careful with it. I use it when I really need to sleep. And then even this last time, I kind of found that, man, it's wearing off right before I go back to bed. So I started timing it a little bit earlier, and I used the spray earlier in the day so that I was ready and I had it wearing off earlier the following day, because I don't mind being plugged up during the daytime as much as at night. So you can kind of monkey with that, but it's a great medicine. You just have to be really careful with it. So those are the decongestants: phenylephrine, pseudoephedrine, and oxymetazoline as a nasal spray. Then we got, let me just quick check here, the antihistamines. Antihistamines. And there are a bajillion antihistamines on the market. Some are prescription, some are over the counter. The most common ones that you and I are going to see over the counter are the diphenhydramine, which is Benadryl, and the doxylamine. Okay, these are the two sedating. They're the ones that are going to be in the nighttime versions of medicines. They're going to help put you to sleep and get you some rest. Okay, they're also, especially the Benadryl diphenhydramine, is the go-to for most allergic reactions. Then you've got the other more hay fever, environmental allergy ones, which are going to be your loratadine. That's Claritin. Your cetirizine, which is your Zyrtec, and your fexofenadine, which is your Allegra. Okay, so those can be used in the daytime, again, to just try to help with the itchy, sneezy, watery eye type symptoms that are associated with environmental allergies, as well as colds and flus. So that sometimes what I'll do is have patients take a Benadryl at night and maybe a Claritin, loratadine in the daytime. Again, decoding these things, because sometimes they'll say, don't they have like initials after these things? Like, I don't know, Allegra D, right? What does that have in it? I don't exactly know what the D stands for, but it's one of, does it have pseudoephedrine in it? Does it have guaifenesin in it? It's just another mixture of these different products. Okay, so antihistamines help with the edema, the swelling, and itchy, watery eyes, runny nose type symptoms. And then we've got the expectorants. And that's the guaifenesin, GUAI, phenesin, mucus thinner. It's going to help to thin out the mucus. So this is first-line therapy for bronchitis. It's in all kinds of the different combination medicines. I mentioned, hydration, drinking water. That's even more important, but this is also okay too, and it's safe for folks with heart diseases for the most part. Cough suppressant. This is your dextromethorphan. A lot of folks, will call in saying, hey, I need something for my cough. That's first-line treatment, and so some combinations of guaifenesin and dextromethorphan you can get over the counter, or we can send you a prescription. And truthfully, a lot of doctors will say, oh yeah, I'll send you a prescription, and they're sending you a prescription for something that's available over the counter. A lot of folks will call in saying, hey, I need my Z-Pak, hey, I need cough syrup, hey, I need this and that. And it can take a lot of energy for a doctor to try to explain all this to you. And we want to, but a lot of us have to see so many patients. And so anyway, that's why I'm doing this, because if you understand kind of what we're thinking, then hopefully it helps you get better faster. And another little plug here. I've got a book called What Every Patient Should Know, and it's not necessarily about sinus issues, but it's about those things that patients should know about how to access the medical system so that they don't get double billed, and they don't waste time going to the wrong places, and so they're properly prepared. I just saw so many, and I have seen so many times where patients are so frustrated with the medical system. And so I try to put this book together that gives you guys some insight into how to access the system. So you can find that link on my website under the book link, What Every Patient Should Know, and that'll link you to Amazon. But anyway, sorry for that little plug there. But it's the same sort of thing. You got all these different medicines, and the more empowered you guys are, the more money you save and the better you feel, because you get better faster. The last thing that I hadn't done on my previous video that I just want to mention are steroids, because a lot of times we do end up using steroids, whether that's like prednisone, that would be prescription, prednisolone, methylprednisolone. So these ones are prescription only. But the nasal steroids, some of the nasal steroids are available over the counter. That would be your fluticasone and I think this one is available over the counter, triamcinolone. Okay, nasal OTC. All right, these are also used primarily for seasonal allergies. Fluticasone is your Flonase, and the triamcinolone, I believe, is Nasacort. I think that's what it is. These you can also use when you're dealing with the sinus upper respiratory deal. So I would suggest using one of these nasal sprays in the morning. So you do your sinus rinse, and then you spray up there with the nasal steroid, and that way at bedtime, you do the nasal rinse again, and then you use that oxymetazoline nasal spray to open it up overnight. Okay, so that's a lot on over-the-counter medicine pharmacology. Again, if you can start to recognize these things, and you can look at the generic bottles and say, oh, these have the same ingredients, but this one is cheaper. Then again, you don't double up on medicines. You don't want to be doubling up and tripling up on some of these combinations, and hopefully it saves you money too. We are going through a lot here. Number 6 is kind of the final thing, and that is, when for antibiotics. So the signs of a possible bacterial sinus infection, we're never really 100% sure, okay? Because we don't drill a hole in somebody's cheek, take a sample, culture it out, and see what kind of bacteria grow. So we go by just clues in the history and in the examination. So some of those things are, how long have you had symptoms? Generally, it takes at least 10 days for someone to develop a bacterial sinusitis, okay? Again, because you have to have mucus production, It has to be stagnant there for a while, then the bacteria have to grow and create pus, okay? So 10 days at least. If you think, hey, I need a Z-Pak, I'm gonna encourage you, do these other things until day 10, okay? If you get there and you say, oh my goodness, this is getting so much worse, then that's perfect. Call us up and it's much easier for us to treat that, okay, after 10 days. And then additional considerations are those symptoms steadily worsening? In fact, do you have much more thick mucus drainage? That's another thing to just mention. Color of mucus is not pathognomonic. It does not indicate with 100% certainty that it's bacterial, okay? If you have a clear runny nose, it's probably not bacterial, okay? Very, very, very low likelihood. If you have yellow, green, thick mucus, it might be, okay? But it doesn't determine that it is, okay? So you do want to have the thick mucus, you want to have 10 days, and then tenderness. Like if you tap on your frontal sinuses like we were doing earlier and you just go, oh, that really hurts. You know, my jaw hurts, my teeth hurt. Oh, this is just unbearable. I shake my head and I can just feel it throbbing. I bend down to put my shoes on and oh, it hurts. Those are some of the other symptoms of a bacterial sinus infection. Finally, if you had been doing really well, you thought, hey, I thought this was allergies, I thought it was a cold, but then boom, it got bad. Like, oh, now I do have all that facial pain and pressure. That's another good time to call us up because that might indicate that that mucus did harbor bacteria and it has grown, okay? So Z-Pak is not necessarily first-line antibiotic treatment, by the way. Penicillins are. So amoxicillin or augmentin, that's usually what we're going to use first. Sometimes then we could, if you're allergic to those, or another thing people will say is that I'm immune to certain antibiotics, and antibiotics don't work that way. You aren't really immune to it. If you happen to have mutated bacteria for some reason, then you know maybe the bacteria are immune to it. I mean that's a technicality. So, but first line treatment is going to be penicillins. We kind of move into the Z-Paks, azithromycin, doxycyclines, sometimes cephalosporins. So those are going to be the antibiotics that your doctor might talk with you about. Another little note here, if you end up on an antibiotic, you know, or steroid for that matter, these things kill bad bacteria, but they also disrupt gut flora. So the good guys that live in your digestive system. Okay, and this is one of the functional medicine tenets. The gut health is so critical to your overall immune system health, to, you know, dealing with autoimmune issues, to just so many things, irritable bowel. So if you take an antibiotic or steroid, I really do recommend that you take a probiotic. Okay, those are the beneficial bacteria supplements. Pick up a reasonably good one, maybe not the cheapest, maybe not the most expensive. Take maybe a double dose before bed. So if you're taking your antibiotics during the daytime, take your probiotics before bed while you're on antibiotics, and then, you know, a few weeks beyond that as well, okay? This is just to help care for your body. Again, on my full script account, there's a whole bunch of probiotics that I have listed there under the probiotics category, and you can kind of look at those. There's a whole variety of them there. So I would go for maybe one of the middle of the road ones if you wanted to just pick one up, you know, probably in the $30 range. So anyway, that's another little tip that, you know, every patient should know when they're taking antibiotics and such. But hopefully, again, if you do these sorts of things, do that saline rinse the whole time, the hydration, these basic things, hopefully we keep that mucus moving out and it does not settle in there, does not become a bacterial infection. The other thing that I mentioned in a couple of my other videos is just to expect viral upper respiratory illnesses to have a, you know, kind of a phase, a process that they go through, where you start with a scratchy throat and the yucky feeling, and then it kind of moves into your sinuses and you get the runny nose and congestion. And sometimes that postnasal drainage will set into your chest and you now have a cough. And sometimes that cough and mucus drainage can last, you know, 7-10 days. Worse in children typically because they can't move it out very well. But for adults, you know, you keep moving it out and you're going to be fine. You're not going to need an antibiotic, you know, and that's better for you in the long run. Okay, again, I'm Dr. Collar. Thanks for watching this video. I hope it was really helpful. I'm going to post the little cheat sheet handout there on the website as well, so you can download that and have that handy. Pick up, order some supplements from me if you want. You can go onto the FullScript account and just kind of create a profile. They'll mail it to you, and usually those things will get to you within a few days. I think it is a good idea to have a stock of that stuff as you head into the fall, just so that when it starts to happen and you go, uh-oh, something's happening, you can start right up on the vitamin C and the zinc and the D and get your sinus rinse going. That's what I do. First sign, I start treating it. And then if you're interested, check out my book at What Every Patient Should Know. There's a book link there. I'm going to link you to Amazon. And I invite you to follow me on Facebook. I do post more of the informal things there. And I think that's about it. Okay. Let me know if this is helpful. Leave comments and feedback. I really appreciate it. And I hope this helps you guys. Okay. All right. Thanks.